Good day, everyone. So I am Charisma Bless, and I am going to discuss about lung abscess. So lung abscess, it is a localized collection of pus caused by microbial infection. It is generally caused by aspiration of anaerobic bacteria. So by definition, in a lung abscess, the chest X-ray demonstrates a cavity of at least 2 centimeters. The lung abscess is a localized necrotic lesion of the lung parenchyma containing purulent material that collapses and forms a cavity. So the classification of lung abscess is the primary and secondary lung abscesses. So the primary lung abscess, it is infectious in origin, used when abscess develops in individuals prone to aspiration or in general good health. So 80% of lung abscess is primary and 50% of this associated with bruted sputum. And then the secondary lung abscess, it is caused by pre-existing condition like obstruction, which is spread from an extrapulmonary site, bronchiectasis, and or an immunocompromised state. So the duration of symptoms prior to diagnosis is when the lung abscess is acute, it is less than one month, and if it is chronic, it is more than one month. So there are three types of lung abscess. The first one is the inhalation. The location of this is dependent areas, 9 posterior segments of upper and lower lobes. There are stages. It includes pneumonic stage, which is the patch of consolidation, and then rupture, the central necrosis, communication with a bronchus, and expectoration of the liquid centri. And then the acute cavitation, which is the irregular thick wall, shaggy or the cordura, inner margin, and surrounding consolidation or decollection. The chronic cavitation, it is the thin wall or the smooth inner margin and subsidence of surrounding inflammatory reaction. The second type is the pneumonic abscess. The complication of pneumonia includes staph pneumonia, the Klebsiella pneumonia, and the tuberculosis. The necrotizing Klebsiella pneumonia, so this is the lung abscess with bulging fissure or a long narrow opening or line of breakage sign. The third one is the lung abscess. It is an abscess arising distal to the point of arrest of a septic embolus. So the aseptic embolism, it is a type of embolism that is infected with bacteria, resulting in the formation of a pus, a clot, or other plug, usually part of all of a thrombus. So the sources of the septic emboli includes the infected catheter, the infected pacemakers, and the tricuspid endocarditic or the IV drug abusers. So let's proceed to the pathophysiology of the lung abscess. So the modifiable factors includes impaired cough reflex or the aspiration of oropharyngeal secretions or the gastric contents can occur, leading to infection and abscess formation. And then the second one is the drug addiction. So substance abuse, especially intravenous drug use, increases the risk of bacterial infection. And then the alcoholism. So alcohol abuse can lead to poor nutritional status, immune suppression, and greater likelihood of aspiration. And then the compromised immune function. A weakened immune system makes it harder to fight infections that can lead to lung abscess. And then the nasogastric tube feeding. So it can also increase the risk of aspiration. And then the last one is patients with altered state of consciousness. This is due to anesthesia. So because anesthesia impairs the protective reflexes like coughing that prevent aspiration. So let's proceed to the non-modifiable factors. It includes the central nervous system disorders such as stroke, neurodegenerative disease, which can impair the patient's ability to control swallowing and coughing. The next one is the esophageal disease. So these conditions can lead to abnormal swallowing and increase the risk of aspiration. And then patients without teeth or the indolent patients. So the indolent patients the indolent patients may have a difficulty chewing food properly, which also increases the risk of aspiration. So most lung abscess are a complication of bacterial pneumonia or are caused by aspiration of oral anaerobes into the lungs. Then abscesses also may occur secondary to mechanical or functional obstruction of the bronchi by a tumor, a foreign body, the bronchial stenosis, necrotizing pneumonias, tuberculosis, pulmonary embolism, and then chest X-ray. Then the growth of bacterial at site and increased secretion of mucus. So most lung abscesses are found in areas of the lungs that may be affected by aspiration. So for the site of the lung abscess is related to gravity and is determined by position. For patients who are confined to bed, the posterior segment of an upper lobe and superior segment of the lower lobe are the most common areas. Initially, the cavity in the lung may or may not extend directly to a bronchus. Eventually, the abscess becomes surrounded or encapsulated by a wall of fibrous tissues. So increasing area of infection later becomes necrotic. So the necrotic process may extend until it reaches the lumen or the lumen of a bronchus or the pleural space, and then establish communication with the respiratory tract, the pleural cavity, or both, or if the bronchus is involved, the purulent contents are expectorated continuously in the form of sputum. If pleura is involved naman, an empyema results. So a communication or a connection between the bronchus and the pleura is known as bronchopleural fistula. So the signs and symptoms of lung abscess includes fever, productive cough, bloody sputum, leukocytes, pleurisy or dull chest pain, dyspnea, weakness, anorexia, weight loss, and then the complication also includes bleeding, the bronchopleural fistula, and the empyema or the chronic abscess. The diagnostic exams includes chest X-ray. This is to reveal an infiltrate with an air fluid level, and then sputum culture. The fiberoptic bronchoscopy, it is a visual exam of the breathing passages of the lungs, and then CT scan to provide more detailed images of different cross-sectional areas of the lungs. So now let's proceed to the medical management of lung abscess. So the first one is the physical examinations, chest X-ray, sputum culture, and the sputum culture. This is to indicate the type of organism and the treatment required. And then the postural drainage and chest physiotherapy. This is for adequate drainage of the lung abscess. So some patients require insertion of a percutaneous chest catheter for weakness, anorexia, weight loss, and then the complication also includes bleeding, the bronchopleural fistula, and the empyema or the chronic abscess. The diagnostic exams includes chest X-ray. This is to reveal an infiltrate with an air fluid level, and then sputum culture. The fiberoptic bronchoscopy, it is a visual exam of the breathing passages of the lungs. And then CT scan to provide more detailed images of different cross-sectional areas of the lungs. So now let's proceed to the medical management of lung abscess. So the first one is the physical examinations, chest X-ray, sputum culture, and the sputum culture. This is to indicate the type of organism and the treatment required. And then the postural drainage and chest physiotherapy. This is for adequate drainage of the lung abscess. So some patients require insertion of a percutaneous chest catheter for a long-term drainage of abscess. Also, it includes a diet high in protein and calories because chronic infection is associated with a catabolic state necessitating increased intake of calories and protein to facilitate healing. Then the surgical and pharmacologic management. So pulmonary resection or the lobectomy is performed in case of massive hemoptysis or the cupping up of blood. If this occurs or if there is little or no response to medical management. So the drug therapy includes antimicrobial therapy, which includes penicillin, clindamycin, and then metronidazole. And then the next one is the oxygen support. This is to maintain adequate tissue oxygenation. So let's proceed to the nursing management. So administer antibiotics and intravenous therapies as prescribed, and then monitor for adverse effects. Chest physiotherapy is initiated as prescribed to facilitate drainage of the abscess, and then deep breathing and coughing exercise to help expand the lungs, and then proper nutritional support, which includes high protein, and then emotional support because the abscess may take a long time to resolve. So the prevalence of lung abscess, the incidence of lung abscess acquired in the community is unknown, but this is a common clinical problem encountered in developing countries. So the incidence of lung abscess was high in the pre-antibiotic era, but the advent of susceptible antibiotics, it has reduced with an equal fall in mortality to 8.7%. Then the prognosis for lung abscess is generally favorable. Over 90% of lung abscesses are cured with medical management alone, unless caused by bronchial obstruction secondary to carcinoma.